Hi, thanks for joining us today. We've got Dr. Joan Kim, board certified ophthalmologist with Visionary Eye Consultants, and we're here today to learn a little bit about diabetic retinopathy. Thank you so much for joining us today, Dr. Kim.
Hi, thanks for having me.
So we have some questions just in general. What is your experience? What causes diabetic retinopathy, and what should patients know about diabetic retinopathy? And what is it?
Sure. So, we know diabetes is such a, um, prevalent disease now. It's shown to affect about 10% of the US population. So we really have to, pay a lot of attention to it. The way that it manifests, oftentimes, it affects the small vessels in your eye, in your retina. And the vessels can actually start to get damaged by excess presence of sugar in the blood. So the vessels will start to break down, they'll start to bleed, they'll swell, and if severe enough, it can damage your vision.
Okay, and can you tell us a little bit about what sort of symptoms you might have if you have a problem with your eyes and you're diabetic, or sometimes do you have no symptoms? What can happen?
Yeah, so the dangerous thing is that very early stages, you may not have any symptoms. So generally, our primary care doctors are going to recommend our diabetic patients to get eye exams, whether their vision is great, whether it's not, because sometimes we can notice very early changes in the vessels. And the thing is, diabetes affects the small vessels in your body. That mainly includes your eyes, your kidneys, your nerves. So, but the problem is, we can only see the vessels in your eye. So, even if we start to see very early changes in your eye, it's kind of a warning sign for us because we know your kidneys are right behind, your nerves are right behind, so we need much more strict treatment for the diabetes to get the blood sugars down to make sure we don't start to see damage in those other organs.
Yeah, so I'm just going to throw in there that I was actually working at a wound care center as a medical director and saw end stage diabetes complications. And the three things that we know that are preventable with diabetes are retinopathy, nerve damage, and kidney damage, right? And those are the three things that we can reverse with really tight glycemic control. And so it was really unfortunate to see people at such an end stage place getting treatment for what was diabetic nerve damage to their feet that eventually led to wounds and open sores.
Right.
But yeah, so how often should someone with diabetes get an eye exam, and when should they start getting their eye exams?
So usually we recommend, at the diagnosis, they should get a baseline eye exam, depending on the severity or the presence of diabetic retinopathy, or depending on how well their blood sugars are controlled or not well controlled, that'll kind of depend. But someone who is pretty well controlled and has no signs of initial diabetic retinopathy, usually our recommendation is at least once a year because we still want to make sure we're not missing any very small changes in the vessels in the back of their eye.
Great. And what are the things that you do if you see changes, and why do you do them as opposed to just watching and waiting?
Um, well, there are some things. So if we see very early changes that are pretty mild and that don't, indicate treatment, then we really just try to emphasize the need for strict blood sugar, not only blood sugar, but also blood pressure and cholesterol control. Because even if someone has signs of diabetic retinopathy, but they say, oh, my blood sugars are very well controlled. We know that if your blood pressure and cholesterol are not well controlled, you can have even worsening changes in your retina.
Yeah.
So, yeah, so even if you're showing signs of retinopathy, the treatment that we provide is really just like a band-aid because that's not addressing the underlying issue. Whenever we start to see damage in your eyes, the most important thing is to get better control of your systemic condition, of course, diet and exercise, and any supplement, any medication that may be needed.
Yeah, and that's why I think it's really great that you're here today working with the primary care physician to help kind of manage and make sure that those things are really being addressed. If it gets to the point where they're having, what are the complications? Like is there detachment? What are the end stage things that happen in the eye if you don't control your diabetes? And then what do you do surgically?
Sure. So if you start to have symptoms, if your vision starts to get blurry, that may be a sign that you're developing swelling in your retina. You may, uh, and that may require laser injections, possibly surgery. Um, in terms of really end stage disease, the vessels, what happens is they start to shut off, and the loss of oxygen starts formation of new vessels. But these new vessels are not healthy vessels. They're very weak and friable vessels, so they bleed. So at that stage, you often need more serious treatment, injections, laser, possibly surgery, because those can lead to more severe things like retinal detachments. So, yeah, of course, any sudden new changes in your vision, new floaters, flashing lights, changes in your peripheral vision, you'd want to see your doctor right away.
Yeah, the ophthalmologist. And those are really good kind of warning signs for patients with diabetes to make sure that they have an ophthalmologist they've already established care with so that they can reach out directly if they ever have
Absolutely.
any emergent type of needs like that or go through the ER, obviously.
Right.
Well, then, so are there any kind of myths or things that you hear and any things that you want to replace those myths with? I understand diabetes to be one of the leading causes of blindness, and you may have said this in the beginning, but can you reiterate for us sort of where it falls on the spectrum of reasons that people go blind in this country?
Yeah, I mean, because it's such a prevalent disease, it is one of the leading reasons for vision loss, not even US, but also worldwide. But the thing is, it is one of the most preventable reasons for vision loss. So, especially in the US, where we have access to such great care, you know, early changes, the best obviously is prevention. So, working with, doctors like yourself who are taking, good care of, the whole person, that's really the key. But if you start to have damage, then getting treatment early, getting treatment effectively and efficiently, that's going to be the best thing you can do to maintain good quality of your vision.
Great. Thank
Um,
you so much.
for
That's
sure.
so amazing. I wanted to point out that a lot of times people tell me I can't get into the ophthalmologist, and they have issues with their insurance covering it, or if they don't have insurance, they think that they can't get care. Can you speak a little bit about how your practice operates for patients in general for all eye care, but specifically in this case, diabetes eye care?
Sure. So, I mean, generally, we really try to at least keep slots open, enough slots open to be able to see emergencies, to see patients with, urgent eye care needs. So being able to see them within the same week, things like that. So, you know, generally we try to triage when someone calls and see what kind of level or what kind of urgency they need to be seen in. But yeah, obviously, there are a lot of eye doctors in the area, but at the same time, there are tons of patients. So yeah, I would say if you are having an issue, you really want to, call around if you don't have an established eye doctor to try to get seen as soon as possible. But like you said, yeah, it's so important. A lot of patients come in and they're like, "Oh, I don't know. My doctor kept telling me to get an eye exam, but I don't know why. I don't know why." And then when I do an eye exam and we start to see changes and I can show them and I can really emphasize, really bring home the need to get better control of their diabetes, their blood pressure, their cholesterol, because if it gets worse, we know what's down the road. We know that it can cause irreversible vision damage.
Yeah, that's great. Thank you so much for explaining that. Anything else that I forgot to ask about that you want to clarify here?
One other myth that, often comes up is that some patients will come in and they'll say like, oh, well, yesterday, my blood sugar was fine. Oh yeah, maybe a month ago, yeah, it was really high, but yesterday was fine. So actually what we've seen is that large fluctuations in blood sugar actually can be more damaging than sustained high levels of blood sugar because your body just is having a much harder time to regulate all those large changes. So fluctuations are not okay to have, days where you seem like your blood sugar is okay, but then some days where it's really out of control. So
Oh, yeah, that's great to know. I suppose that's probably to do with the osmosis inside the vessel with the level of glucose that's in there. I didn't even
yeah,
know that. So
yeah,
thanks
because actually in some cases too, where you are seeing changes in retinopathy and then patients do get better control over their blood sugars, we can often see worsening damage
Mm.
because they're the vessels are still weak, and so we can see that initial worsening before it gets worse.
Yeah, so that really speaks to the importance of consistency in taking medications and
Yeah,
managing regularly your diet and exercise and not kind of doing these big swings of one day
exactly.
remembering meds and one day not remembering meds. Yeah,
Yeah,
that's really good to know. Thanks so much.
yeah, yeah.
Can you speak a little bit about your practice, where you're located, and how people can reach out to you if they're interested?
Sure. My practice is in Des Plaines. I've been in practice I've been practicing ophthalmology for over 10 years now. And I am a cornea specialist, so I do specialize in things more like cataract surgery, corneal transplants, refractive surgery, things like that. But I obviously also do general exams if someone has serious diabetic disease that needs treatment. I usually will refer them to a retina specialist.
Okay, great. And then in terms of insurance, you accept Medicare?
Yeah, absolutely. Medicare, most PPO plans, and some Medicare, Medicaid plans as well. So, yeah.
And for uninsured patients, do you have cash pay available to
Yeah,
them?
we do. And we really try to make it affordable. And especially if they're coming as a referral from yourself or from other doctors, we really try to provide discounts and help
Yeah, no,
them.
you've been a phenomenal resource for my practice and my patients. So I just want to say thank you so much. I really
Oh, great.
appreciate it.
Oh, thank you.
Yeah, okay, great. Well, we'll see you next time.
Yeah, absolutely. Thank you.
Bye bye.